Hi everyone, thanks for joining us here at Smile Vision. In the next few minutes, I'd like to present a simple protocol for doing more and better anterior dentistry. It's going to be a very simple approach, but don't be deceived. There's a great deal to be learned here. I'd like to just make a couple of comments first about general dentistry and the way it's changing. For example, fluoride has really reduced the number of caries throughout the population, and as people are aging, they're having less dental work, less endo, less crowns, less rehabilitations. The older generation, pre-fluoride, is slowly dying off, I hate to say, and so there's less and less routine work out there to be done. Another point to address is competition. The dental workforce has changed. A lot more dentists are willing to work as salaried dentists, so there are many more commercial dental chains that compete on fees. And so we have a general reduction in fees, and also, of course, insurance companies are now controlling the fees for many of you. And so, all in all, general dentistry is not what it was 10 years ago. Of course, the economy also has something to say about that. Cosmetic dentistry is a real big opportunity for lots of you. First of all, there are no fee caps. You're on the private market. It's not covered by insurance, and unless your insurance carriers prohibit it, you can charge what you need to charge to do a great job. Second of all, there's plenty of need. I mean, there's nobody who's 60 years old that couldn't use a retread. Teeth age, they look dark. So there's plenty of people growing older who can use these services. Cosmetics are fun to deliver, with a lot of psychic reward for the dentist and a lot of benefits for the patients. The only thing is the process has to be sold. Patients don't see the changes that go on as they age unless it's called to their attention and unless the dentists do something to make people want it. And so in the next few minutes, I'm going to talk about 3 different areas. One is how to present your cases better so that you create the want and increase your acceptance by 300% or more. Then I'm going to talk about planning. Planning so you know where you're going in advance. So there's no mystery, so everyone is on the same page. Dentist, laboratory, patient, everybody knows what's going to happen. And then how to deliver your cases with predictability in half the time, with twice the patient's satisfaction. So now I've made a lot of promises. Let's see where we can go with that. Just a tiny bit of background. Ptolemy was a very influential astronomer around the time of Christ, and at that point people believed that the sun revolved around the earth, the geocentric theory. And then some new concepts started to come along that were slow to be accepted. When Copernicus came along in 1400 and said, hey, let's take a look at this, guys. Maybe the earth revolves around the sun. That seems to fit well. Nobody wanted to believe him. And it took more than his lifetime for this to be commonly accepted. That's a paradigm. Boundaries that rule or limit our horizons. They take a while to become accepted, but once broken, you can never go back. So ask a child today of 8 years old, does the sun revolve around the earth or the earth around the sun? And of course, they'll know the answer. So it's common knowledge today, but at the time of Copernicus, it wasn't. So that's breaking a paradigm. Well, there are some paradigms to break in our field as well. For example, I remember when one-visit endo was considered the work of the devil. Implant dentists were considered to be quacks, where now most general dentists have implant training and do implants on a regular basis. Also, I remember when there was a dentist who advertised were considered to be less than upstanding part of the profession. Well, now I'd like to talk about cosmetic dentistry, which currently is thought to be difficult, requiring a certain artistic ability. I'd like to break that paradigm, or at least in your mind, I'd like you to think about making it cosmetic dentistry fun and simple. We'll do that using the template technique. From that, with the template technique, you'll plan your case from an aesthetic perspective. Then you'll build your function around that vision. We've done over 2,500 cases at Smile Vision with wonderful results. We've been developing this over a 20-year period. I think this is something that you'll really find very, very helpful, but you have to keep your mind open because it runs counter to a lot of current thinking. The idea here is to plan your case so you know where you're going in advance. Now, here's an outline of the plan. Number one is we're going to use cosmetic simulations to present and plan the case. Then we're going to make temps that verify the plan. And then we're going to insert with more predictability than ever before. So let's talk about part number one first, the full face cosmetic simulation. It gives people a reason to say yes. It gets family and friends on your side, and it lays out a blueprint for success in advance. Cosmetic simulations stimulate emotion. How am I looking is very, very important to most people. There are billions of dollars spent every year right in this country on hair care. Women pay hundreds of dollars a month to avoid having gray hair. Why wouldn't they want to have a beautiful smile? Now, here's an example of a cosmetic simulation, just to make sure we're all on the same page. You can see this lady is an attractive older woman, and yet you can see that her appearance is enhanced by having a beautiful set of teeth. Let me go over that again. There she is before. And here she is after. Makes a big difference. Here's a young lady before, and here she is after. Let's do that again. There's before, and here we are after. So these are cosmetic simulations. But they're more than just a way to communicate with patients and to show them where you're going, because simulations are a very important planning and diagnostic tool. In this case, for example, you can see that the anterior plane of occlusion is not parallel to the eyes. When we do the simulation, we make sure that they are parallel to the eye, that the plane of occlusion is parallel to the eyes. This information will be carried over into the final case. And so simulations are a way to, number one, communicate with your patient, and number two, it's a diagnostic tool. It's Smile Vision. We do these simulations. We're an outsourcing center for cosmetic simulations. You put these on the web. We make the changes according to your prescription and return it to your office. We have experienced artists. Check each one to verify that the work that we're showing you is clinically accurate and attractive. Of course, it's up to the doctor and the patient's family and friends to make the final decision about what looks good. We're simply a vehicle at Smile Vision for putting it out to the doctor and the patient. So remember that redraws of the simulations are easy to do on the web. They're quick to do, well worth the effort. So here are a few tips to remember about cosmetic simulations. First, let your patient make the aesthetic decision. Here are two ladies that are all dressed up, ready to go to a party. In their cultures, this is beauty. It's important that your patient be in on the choice of the cosmetic result, because the same result on two different people may be interpreted differently. So it's really important to get the patient online first. Secondly, when people are purchasing something expensive for a lot of money, they want to see what it is you have to deliver. For example, would you have an addition to your house made without seeing a blueprint? Would you trust a contractor to say, "Here, I can do this, watch, it'll look great, trust me"? Or would you rather have it drawn out for you? How do you expect patients to accept your word for it? And finally, it's very important to build support with family and friends if you want to get your cases accepted. Unless everyone in the family understands what's going on and what the objectives are, you're going to get a lot of people backing out on your cases. Now that you've presented your case properly, let's talk about delivery. That's part 2. You want to follow the aesthetic plan you've created because the patients accepted it. But that's easy. With the template technique, you're going to start with artistry, and that's the cosmetic simulation, and you're going to plan out what looks good. After that, you're going to implement it with craftsmanship, and that's where we are now, how to actually implement the case. Here's the way cases were done in the past, a skilled ceramist looking at the teeth and trying to make something that looked good. The problem is he had nothing to go by. No soft tissues, no smile line, and that made it very difficult. So instead, we're going to bring the cosmetic simulations to life by creating ratios between the teeth and the images to create a life-size replica in wax that will represent the case as it will be when completed. The next step after creating the replica is to show the doctor the replica online. And so you'll get a call, if you're doing the case with us at Smile Vision, to take a look at your case. Here's how it'll appear on your imaging site. You'll have a chance to comment or to call the technician. But so now the doctor has his input to approve the case before it's shipped. The wax up is then duplicated and the wax turned into resin. The upper one represents resin that looked exactly like the wax up. The bottom is the duplicate. And a preparation guide is made. You can see here it being used to verify that the preparation will allow the technician sufficient room to create the result that is pictured in the images. A very important step. If the wax up is a very difficult one and you're still not sure that you can deliver what you've promised because the teeth are crowded and so on, we advise that you prepare a case, a model over the sink and then put the prep guide over it to verify that yes, you can do this. In other words, before you sit down at the chair, you want to make sure you know where you're going, that there are no surprises. We also make you a temporary template over the wax up. It's a flexible inner layer that doesn't stick to resin with a rigid outer shell to prevent expansion under pressure. And this is now seated in the mouth, filled with bisacryl, and seated in the mouth with pressure. Use your fingers to remove the outer shell, peel off the inner shell. See the upper one here on the left has the inner shell still on it. Peel that off, and there you end up with temps that are practically ready to go. You can see that the amount of flash is tiny. The real advantage here is that you have temps that make the patient look as they did in the picture. You can see also that a little bit of the outline of the tooth shows here. This is a way that you, the dentist, are able to verify that yes, you have prepared enough and that you have left enough room for the technician. So you end up with a set of temps that look exactly as they should without having to carve in the mouth. Making the patient happy at this point is a big deal. From there, we've gone a long way in the last few years to copying our temps. These cases are milled in Empress, Emax, or zirconia, and Presta zirconia, and we give them to the ceramist 95% ready to go. So the ceramist now has to finish up the margins, fix up any defects, and include the incisal colors and translucency and so on. But because the ceramist gets these cases looking exactly like the temps, the subsequent steps are pretty easy. If you'll notice here, for example, see the highlights? These highlights are the same here as they are here. Here's another case. Again, note the highlights. Note how exactly the temps are reproduced in the final case. That's very, very important, and it makes your job easy. So you know before you start that you're going to get a great case every time.